The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
With us right now, we have Ray Wiley, Associate Director of MTSU's Campus Recreation, and longtime Red Cross volunteer, Gene Baker, and Senior Account Manager of Donor Services for the American Red Cross. How are both of y'all doing this morning?
Wonderful.
Doing great. Thank you for having us.
Tell us what is coming up that folks need to know about.
We have our annual blood drive. It's a friendly battle between MTSU and WKU, and tag team together for 100 Miles of Hope to help people who are in need of blood donation.
And this has been going on for years and years.
15 years, 13 as a competition. Yes, many, many years of collecting a lot of blood.
And it's interesting because here in Middle Tennessee, we actually have a lot of WKU graduates as well, but they're often going to MTSU to be a part of the blood drive.
And we're happy for that too. It's like it brings out the friendly competition, but we both recognize what we're doing and why we're doing it.
Tell us a little bit about where this blood goes whenever somebody donates.
We have a processing center in downtown Nashville, Charlotte Avenue, and that's where the blood goes immediately to be processed and tested. But a lot of it stays here in Middle Tennessee to serve our local hospitals, but a lot of it, as you know, the Red Cross has a national network of blood supplies. So if we need, for instance, right now, many blood drives down with Hurricane Debbie had to be canceled. There's disruptions down in that region, and if we have to, we'll send blood down there. That's what is advantageous about our network, is we can get blood anywhere that is needed, and any type of blood.
So if there is, let's say, a car wreck in Louisiana, sure, and they don't have that type of blood that's needed, but you've got it here, how fast can you get that blood to them?
It can certainly be overnighted or as fast as we can get it there in any type of transport. But yeah, I mean, if there's a particular blood type that is needed, we have that advantage with our national network.
And again, this blood, you said a lot of it is used right here in Middle Tennessee, the local hospitals here.
Most certainly. We service, obviously, our local community first. But, as needed, I being a regular donor myself, have seen with my donor app, you know where your blood goes, so you can check it out. And I've noticed mine has gone to Missouri here and there, or maybe down in Georgia. So I've noticed it has gone different places, but mostly it goes to hospitals.
That's interesting. So if you sign up for that app through the Red Cross, you can actually see where your blood that you donate goes.
We have an award-winning donor app. It's a quick, easy, free download, and it is the best thing. If you have been a donor for years, it would automatically dump all of your history into the app. You're walking around with your health history, basically. You can see what your blood pressure, you can see your vitals were for your entire history of the day you donated blood. You see where your blood goes. You can read up about donations, about any past donations, or gather any pertinent information for today. But it's just a little health tracker. I can see what my blood pressure's done for the last few years. So
that's really interesting. So once you sign up, they input, let's say, from 1995?
Yeah, we go back. It goes back, I think it goes back to the 80s. There are, I think in the 70s, we've noticed that, I know some folks said my stuff from the 70s didn't show up. So our records do go back, I would say, about 40 years or so.
That's awesome.
Yes,
what a neat thing to have and download.
Yes.
And then talking about MTSU and this history with WKU, how did all of this start?
It really got started years ago when Chris Massara was hired as our AD in athletics. And Chris was a part of a rivalry between South Carolina and Clemson University many, many years ago. And so he brought that idea here. We were able to implement that with WKU being one of our main rivals. They were on board from the beginning. And it's been a great partnership for both communities.
And again, this is a major blood drive going on that will go on in Murfreesboro and then also in Kentucky at WKU on their campus.
Yes, on the exact same days in September, the 9th, 10th, and 11th. That's Monday, Tuesday, Wednesday of September. And it's from 11 to 6 each day. And it's going to be held on our campus at our facility there at Campus Recreation, 1848 Blue Raider Drive.
And Gene, how significant is this blood drive for the Red Cross? Is this a large blood drive, or considered a large blood drive?
Most certainly my largest blood drive. MTSU is my largest sponsor, and this is their largest operation of all their drives through the year. This blood drive between the two schools has literally anywhere from 1,000 to 1,400 participants.
Wow.
So it by far is the largest blood drive we have, and about the first or second largest blood drive we have in the region. It is very, very important, especially it comes on the heels of summer. For instance, this summer, millions of Americans have experienced dangerous levels of heat. And at one point in July, nearly 50% of Americans coast to coast were under heat alerts. So this impacted about 100 blood drives in July in nearly every state where the Red Cross collects blood. So add that to the traditional obstacles we face every summer. Travel, summer activities. Summer is our toughest time of year. We had a shortfall in July of 19,000 blood donations. So we need to replenish that. This drive comes at a perfect time to help that supply. It happens every summer, and we plan the best you could, but blood has a 42-day shelf life, so you can't stock up and plan for the summer. Yeah, like any other product. You have to continuously, every day. Our country needs 29,000 units of blood every single day in this country to meet patient demand, and that product has a shelf life. So blood drives like Ray's here come at a great time and are very, very significant for replenishing our supply.
Hospitals, do they stock blood on hand for, let's say, 35, 40 days at a time after they get it from the Red Cross?
Yes, they do. We have our center downtown that keeps it. But yes, as needed, it is shipped there in stock, but it's pretty much shipped as needed. So that's why our local hospitals are key. Our transport is quicker there, but hospitals do have storage. But once again, it only lasts so long. So it's just a constant feeding of this engine that is needed. I keep going over that number, 29,000 units every single day in the U.S. So that's a lot of blood for a lot of patients, and there's only one way we get it, from other people. We can't make it. We can't buy it at a wholesale store or from Amazon. So it comes from people.
And that 29,000, that's the amount of blood used nationwide every single day.
Every single day. Yeah.
That's hard to imagine.
It's, one trauma event could be 80 to 100 units for one person in one traumatic surgery, so it's, you think about a lot of surgeries, 1 or 2 units, but there's some, gunshot victims, trauma victims that need dozens for one surgery sometimes.
It's really amazing to think about that. And then all the injuries across the nation. I mean, from everything from car accidents to, somebody giving birth. There's all of these issues that come up, or all these events in hospitals where blood is needed. Blood is needed. And a lot of our blood donors, it's something that's affected them personally, why they donate blood. It is a personal thing to them. I would like to just challenge people who maybe don't think about it or haven't known someone with cancer or you will eventually. Everybody in this country will be affected, will know somebody that needs blood sooner or later. And I think all of us in this room, as the older you get, folks that, folks that have had cancer, folks that have had complications at birth or have been in an accident. We especially with young people, we want you to know that, this is going to affect you one day. So get out there and be a regular blood donor. To me, I've got 350 units under my belt. It's one of the most rewarding things I do. It's an instant, to me, it's instant gratification on giving back something very powerful. The limits on giving blood, like let's say somebody has, they take a certain kind of medication, or maybe they've had cancer in the past. Can those people give blood, or is there a list of items or general items that say, no, you can't give, yes, you can give?
Most certainly. Good question. We urge them to call our medical hotline at 1-800-RED-CROSS. I answer some basic questions, but there's a lot of confidentiality involved. There's a long list of medications. I basically tell folks, if you're not on an antibiotic right now, there's a very good chance you can donate. But please call if you're unsure. Some cancers, if you're cancer-free for a while, you can come back and donate. Some are permanent deferrals. There's so many variables, and I don't I don't have a medical background. My background's more of a marketing background, so I don't try to play doctor. I just say, please call 1-800-RED CROSS and ask those very good questions. Chances are, if you are not on an antibiotic right now, chances are you're good.
So a lot of people out there are eligible to donate blood. And again, this big event is coming up on the MTSU campus. What is the date?
9th, 10th, and 11th of September, so it's coming up really, really fast this year. Normally we have a little bit more time to recruit, but we're just grateful to be here this morning and try to get the word out quickly to let people know about our event. Good news is we'll have parking spaces reserved out in front of the recreation center. So if people will schedule an appointment through redcrossblood.org, then they can sign up, and we'll get them in just as quickly as we possibly can there at our facility on the 9th, 10th, and 11th of September.
Tell them about the trophy in the game.
Okay, yeah. Well, I did say it was a friendly competition, but there is a really nice trophy at stake. and we do try to obviously keep that rivalry alive by doing our absolute best, because we know how important it is. And we bragging rights are always a big thing, especially between MTSU and WKU. So yes, there is a nice trophy presented to the winning school that collects the most units of blood, and it's typically presented in the third quarter of the football game, depending on where the game is held.
So MTSU will be taking on WKU, and it'll be at that football game that they talk about the winners. And how has MTSU done in the past as far as taking home that trophy for the blood donations?
It's a traveling trophy. MTSU's held the trophy 7 times. WKU's held it 5 times. 2 years we didn't have it for COVID, so it took a 2-year break.
WKU is catching up then, 5-7.
Yes. So we are looking forward to the challenge this year. We're encouraging everybody to come out and give to support, obviously, MTSU, but more importantly, support the Red Cross mission to help protect our community with blood donations.
The turnout, do you have a lot of students and a lot of faculty members out there?
We do. We're very successful. This is one of the reasons I'm so passionate about this drive every year, is because it brings out the best of our campus. We have, our faculty and staff. Of course, many of our students will come out, and many times we'll have first-time donors. And we're always impressed by how many people will roll up their sleeves for the very first time, just kind of conquer their fears and go, you know what, I need to do this. And their blood's checked before they give, and if their iron levels at the proper level, then they're welcome to give. And when they do, it just, like Gene said, it makes you feel amazing to know that for every unit of blood collected, you could save up to 3 people's lives with that one donation. So this is a worthy cause, and our faculty, staff, and students have rallied behind for many years, and we're excited to host it again this year.
And the really neat thing that Gene was talking about, you can download that app from Red Cross and actually see where the blood you donate goes.
You can, and I've enjoyed getting the results to see where my blood's gone. So when you see that it goes to Vanderbilt Children's Hospital, which mine has gone a few times, or it goes out of state, sometimes it stays here locally, like Gene had mentioned previously, but it's a pretty neat thing to be able to see where your blood goes.
And again, this is on the MTSU campus, the big rivalry between MTSU and WKU with the Red Cross Blood Drive, and the dates again, September 9th through the 11th. And this whole thing is titled 100 Miles of Hope. Once more, it is coming up. You can learn more about it on the MTSU website. We appreciate both of y'all joining us.
Thank you for having us.
Again, with us this morning, we had Ray Wiley, Associate Director of MTSU's Campus Recreation and longtime Red Cross volunteer, and also Gene Baker, Senior Account Manager of Donor Services for the American Red Cross.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.